Hi, I'm Dr. Buonassisi. I'm a facial plastic and reconstructive surgeon. Today we're going to talk about face and neck lift surgeries. There are two main groups of patients that I see that are requesting this type of surgery. There are those that have inherited facial features that they'd like to have changed, perhaps a recessive chin or a double chin. And then there are those who have age-related changes to their face and neck, which start to occur in patients as they get into their 40s and 50s. When talking about patients in the group where they have inherited facial features that they'd like to correct, these are usually changed through procedures like liposuction or buccal fat removal, also chin augmentation or neck lift. And most of these patients tend to be under the age of 40 and often have these features from the time they're in their late teens. The other category or group of patients that we see are those who have changes to their neck and face that are age-related. In this age group, some of the procedures that we recommend may include an S-lift or a short incision or long incision facelift. And this is useful because those procedures actually remove some of the extra skin that occurs as we age. So the big difference between our younger group and our patients that are having age-related changes is that often there is quite a bit of skin laxity that develops with age and sun exposure. And this skin laxity needs to be dealt with usually by removing some of the extra skin. So what you'll notice on this slide is that in the lower half of the slide are procedures that we generally do on our younger patients who have inherited facial features. So for example, chin augmentation or neck liposuction, and they tend to have shorter recovery periods. In our older patients who have some age-related changes, we perform surgeries like a short scar or long scar facelift, and they have a slightly longer recovery period, and that's what's indicated by the red arrow that goes from left to right. When I'm consulting with patients regarding face and neck lift surgery, I think it's really important to think about the risk-reward trade-off. What we want to do is provide the best possible results for our patient with the least risk. So for example, in a patient who has a poor neckline simply because of a recessive chin, a simple insertion of a chin implant would be the ideal procedure for them rather than having an extensive neck lift. However, in a patient who does not have a recessive chin but has lots of skin laxity in the neck, they get a much better result with a facelift or a full neck lift where we can remove some of that skin, and they benefit from a perhaps more lengthy procedure.